Welcome back. Well, I guess a lot falls on me again to talk health. Okay, so over the past 20 months, Nigeria has recorded substantial improvement in routine immunization performance. Prior to the establishment of the National Emergency Recoordination Center, established on July the 4th, 2017, Nigeria's immunization coverage was very poor and fluctuated significantly over the last decade. But since that establishment, there has been some level of increase nationwide in immunization coverage. As of December 2016, Nigeria's national recoverage stood at 34%, but by March 2019, the figure stood at 45%. How did this happen? To help us understand what happened here and what's all about, and how we can get to up to 24% by 2028, 84% by 2028, which is a target, we have the Executive Director, Chief Executive Officer, National Primary Healthcare Development Agency, joining us from our Abuja studio, Dr. Faisal Schweib. Thank you for joining us.
Thank you for having me.
Okay, so significant improvement, some will say, from 34% to 45% in immunization coverage. Is that worth a thumbs up or a thumping of the chest?
Absolutely. So we've witnessed quite a significant jump in the routine immunization coverage over the last 2.5 years. And that is significant because it is unprecedented when you compare to global standards, right? So when you look at the data, most countries that have improved routine immunization have done that at an annual rate of 6 to 10%. But for us to be able to make significant progress, jumping up to 20%, given the most recent figures, that is huge. That is a massive improvement. And I think it's something that we should be happy about. In a sea of so much doom and gloom in the primary healthcare space, you can now see that as a result of the direct leadership provided by Mr. President and the strategic direction that is provided by the Honorable Minister of Health, Professor Isaac Adewole, we are now seeing concrete results as a direct result of all the resources that are poured in, financial, material, and human resources. So Nigerians should be very proud. We're not where we want to be, but we can see from the trajectory that we will get to where we need to be.
There were fears at one time, especially regarding the polio vaccination, immunization against polio. Have all those challenges now been surmounted?
In all but very few places, those doubts have now evaporated. But of course, every now and again, you will find one maybe fake scholar that says, oh, they're not satisfied yet. But overall, as a result of the close collaboration with traditional religious leaders, the state ministries of health, the primary healthcare boards, we can see that we're just some 5 months away from being declared a polio-free nation. And that also means that Africa is finally going to be declared polio-free. That is significant and is a result of all the efforts that we've seen from all stakeholders, including the media, providing the correct information about immunization, about the safety of vaccines, and how people need to take their children for routine immunization in the health facilities. So from being a nation that was exporting wild polio viruses, we're now exiting in the next 5 months from that infamous committee of nations that were endemic for polio viruses. So we should be proud of ourselves because it is exactly the same strategies that we use to eradicate polio that we used for Ebola containment that was globally recognized as an efficient way. And we have now replicated these same strategies with routine immunization. So we're almost done with polio. We've contained Ebola. Routine immunization is on the up. So we should be very, very happy with all the great things that the Federal Ministry of Health, the National Primary Healthcare Development Agency, and all stakeholders have done so far.
Dr. Schreib, the establishment of NERIC, that's the National Emergency Re-Coordination Center, in 2017, well, as commendable as these improvements are, there are concerns about duplicating functions by establishing more agencies when the ones that are there are not effective. Was it really necessary to establish NERIC?
So NERIC, the National Emergency Routine Immunization Coordinating Center, is not an agency. It is a coordinating platform within an agency that is under the Federal Ministry of Health, right? So it is the National Primary Healthcare Development Agency that is an agency under the Federal Ministry of Health. NERIC is only a coordinating platform. So like what we did with the Ebola containment, we pulled in all the stakeholders. So the federal government, our development partners, our donors, traditional leaders, states, local governments, to say, here we are. Only a quarter of our children are properly and fully vaccinated. It is unacceptable. Given our human, material, financial resources, we can do better than this as Nigerians. That is why we pulled everybody together, and on a daily basis, we're looking at the data. We're prioritizing those areas that have the weakest immunization programs. We also set up similar coordinating platforms in the states and the LGS so that people can, on a daily basis, look at what is wrong, what resources do we need, and then how do we use these resources in a way that is transparent and accountable? Are people doing their work? How do we move from strategies and policies that are sitting on the shelf to actual execution, actual delivery? How do you move from just a quarter of children being vaccinated to trajectories that suggest that we will hit our mark of achieving immunization coverage for all Nigerians, leaving no child behind? This is exactly what this is about.
Dr. Schreib,
and we're proud of the work that we've done so.
Dr. Schreib, we'll take a moment, but when we come back, the issue of data collection and management, how accessible is that data to Nigerians who might just want to get details as regards how many people, if we're going by the figure that 2,300 children under 5 years die on a daily basis, old records, how effective has this been, and can the data be followed by individuals on the public space? But we'll be back to answer that question in a moment. Welcome back. We still have the Executive Director and CEO of National Primary Healthcare Development Agency in our Abuja studio. Dr. Schreib, before we went on that break, you were talking about the reason why NERIC was set up, a coordinating center to also help gather and examine data, analyze, and execute immunization more effectively. But on the basis of that, when data is collected, how public is that data? Can it be accessed by anybody? If I sit here and I want to search for data as regards how many people were immunized in my community, can I find that data online? I asked that question based on also information here that on a daily basis, Nigeria loses about 2,300 children under the age 5 and 145 women of childbearing age. This is data out there. So how accessible is this data, and what is being done to reduce these numbers?
Yes, the data is perfectly available. We have data on our website at the Federal Ministry of Health and the National Primary Healthcare Development Agency. And if you actually request for this data, it is public knowledge, specific data that you want to have around your community, your ward, or your LGA, we can provide the data. It is data for all Nigerians. But really, what is of concern is that as we aggregate this data, what are we doing with the data? Data is not being collected just for the sake of collection, but for action, right? So the numbers around women and children dying is unacceptable, right? In the course of the last few decades, there's been some progress, especially in the last 3.5 years. However, we are not where we would like to be. This is why, under the leadership that is being provided by Professor Isaac Adewole, the Honorable Minister of Health, and the overall vision that has been articulated by President Muhammadu Buhari, when he stated very clearly, when he commissioned the Primary Healthcare Center in Kuchingoro in 2017, that the central focus of his health agenda is primary healthcare. This is why 55 billion naira was made available for the Basic Healthcare Provision Fund towards providing universal health coverage for all Nigerians. So no Nigerian will fall into financial hardship just because they fall sick. Globally, over 100 million people on an annual basis become poor after one major illness. So for a lot of Nigerians, you may be in the middle class, all it takes is just one major illness, and you pay out of pocket, and then you become very poor, and then even surviving becomes a problem. This is what President Buhari and the Honorable Minister of Health have really articulated the Basic Healthcare Provision Fund for. So some 55 billion naira, right? Not being utilized in Abuja, but going directly to the primary healthcare centers. One functional primary healthcare center per ward, so that people can access basic healthcare. Pregnant women, children under 5 will not have to pay for basic health services, so that no matter where you live, no matter where you work, you can get effective, efficient, and equitable primary healthcare services in a way that every Nigerian is treated with respect, with dignity, and with compassion. That is the landscape we're trying to change. We all know that our primary healthcare centers are not where we need to be. A lot of them have been taken over, right, by leaking roads, sometimes by animals. But this rot has happened over several decades. What this administration is saying is enough is enough. Over 80% of the medical problems that we have in the communities can be addressed by simple, basic interventions at the primary healthcare level. And this is why we engage with the state ministries of health, the state primary healthcare boards, to make sure that those primary healthcare centers become functional. The state governments are also renovating and revitalizing primary healthcare centers all across, making sure that no matter what, at least there's one functional primary healthcare in each ward, so that women and children can access this care. All of this lines up with the vision that everybody, everywhere, should access primary health care. No one should be left behind.
Now, Doctor, I hear you about the health care, the health insurance, but do you have any information or stats regarding how the rural communities understand what you're talking about getting health insurance so that they don't have to pay out of pocket when major ailments come along?